Welcome, my name is KoenPouwels. I'm a health economist specialized in surveillance of infectious diseases, including antimicrobial resistance and SARS-CoV-2, trial design and related health economic evaluations, survey design and how to adjust for selection bias and non-response, and health economics of antimicrobial resistance and other infectious diseases and related interventions. And this is also reflected in my ongoing projects that are funded by various funders, including the National COVID Infection Survey and several projects trying to evaluate the cost effectiveness of different interventions, including monoclonal antibodies, vaccines, and infection and prevention control measures in high prevalence settings across Europe. As you can imagine, during a global pandemic, most of my time have recently been spending on COVID, and particularly on the National COVID Infection Survey in the UK, which is the largest longitudinal SARS-CoV-2 household survey in the world, which I co-designed, which includes over 500,000 participants with, to date, over 7 million study visits. And actually we have study workers going to people's household at a fixed schedule, so for the first 4 weeks every week and subsequently monthly. And people provide a self, nose and throat swab and answer questions about symptoms, demographics, work status, behaviors, etc. And the random subset also provides blood tests, so we can also evaluate trajectories of antibodies over time. So the survey has been used to address many questions, including trends over time in people testing positive, how that compares to wastewater surveillance, to what extent antibody responses are there after vaccination and natural infection in different groups of the population, and how that declines over time. We've been looking at vaccine effectiveness of the different vaccines and also how that wanes over time, to what extent people change their behavior upon receiving vaccination and upon population level vaccination levels, and various other groups related analysis related to transmission, symptoms, and who is at most risk at various points during the epidemic. And going forward, then I'm very much looking forward to further quantify the economic impacts of SARS-CoV-2 and also think about whether we can design more cheaper and more affordable surveillance systems that are still fit for purpose and affordable for low and middle income countries.